Hi there, and welcome back to our weekly live stream. For those who don't know me, I'm Leah Hadley. I'm the founder of Great Lakes Investment Management and Great Lakes Divorce Financial Solutions, and I help people through money mentorship, financial planning, and strategic investment management. But I am so excited to have our guests here today because we are going to be talking about a very important topic that I get tons of questions about for a variety of different reasons. So, we are talking all about health insurance today. And I have Stephanie Snakovsky here, who is an absolute wealth of knowledge. Believe it or not, Stephanie actually got started in the insurance industry in high school. So, high school, college, she had been doing some things with coding and billing. She spent 10 years of her career with Medical Mutual, 5 years with one of the hospital systems, which is super helpful to have that background. She's worked for different broker offices before she went out on her own. So Stephanie really has seen the insurance industry from all different aspects. So it is really my pleasure to welcome you to be here with us today, Stephanie.
Oh, thank you, Leah. I'm grateful for the opportunity. Thank you.
Absolutely. So talk to us a little bit about what attracted you to the insurance industry, kind of where you are right now and what you're doing.
Sure. With high school, those steps in high school where you needed a job, and I worked in medical offices. So I did that through college, and all the insurance and billing with all these doctors' offices and the mass amount of bills that they submitted kind of started it. So once I went through high school, working through college at those offices, sending out those resumes, and what was then Blue Cross Blue Shield, an opportunity came up. So I jumped at that opportunity and been in it ever since.
Fantastic. And tell us about what you're doing now.
So right now I'm an independent agent broker, and so I am licensed with all the major insurance carriers. I work with small businesses, individuals, and Medicare folks, and navigating all their options with small businesses. I assist in marketing their plans with all the different carriers to make sure in this high cost with health insurance that they're getting the best dollar and they're in the right place and the right plan with their culture and with their insurance needs. And then with Medicare folks, there's all kinds of changes, and just educating our seniors on all their choices, and making sure that they're informed and educating. And I think that is a friend of mine told me that what she recognized with me is my interest in researching. I love to research. If I don't know the answer, I'm definitely going to research and try to find that out for somebody, because I like to be thorough, and I want to make sure folks know that I'm coming from a knowledgeable place.
Fantastic. And I know one of the things that in the short time we've known each other that I realized about you is that you're a wonderful educator as it relates to health insurance as well. So, not just the research, but really helping people understand their options in this space that can feel so overwhelming. So, I'm curious, what are some of the common misconceptions regarding health coverage, especially during life transitions, that you've noticed?
Um, I think that folks are not educated at all their options, and I think that's where my hospital experience comes into play, depending on folks' budget, because that's first and foremost based on those life transition changes. And that's where you really need to zero in on their comfort level with that budget. And so I share with folks some options that they may have not even knew was out there and available based on their budget and based on the circumstances that they're going through. And that's, I'm not your traditional salesperson. I like to share and educate with folks, and then we can talk through and strategize as far as what works for them.
Okay, so one of the big misconceptions is just what is even available, right?
Sure. So short term is a good option. There is underwriting involved with the short term plans. Um, there's several carriers that I work with for those, but if right out the gate, folks have a pretty significant health insurance, and we just kind of eliminate that. We, of course, have the marketplace, healthcare.gov, and it's really important for folks to get a broker agent to really talk through some of those plans, because if you do not look at those networks, you're going to sign up for a plan that is you're going to be traveling and going to a provider that you're not even comfortable with. So it is really important to be thorough with those marketplace plans and researching those networks. There's individual plans. Those are also a good option with a lot of the carriers. If you're not eligible for the marketplace, maybe you're a little bit higher income. So those come into play as well. So the individual short term and then the marketplace. Some of the other options, I come across financial assistance within the hospital systems, again, depending on their income and such, is another resource.
Yeah, that's a great point. I was working with a couple who was going through a divorce, and one of the parties was undergoing cancer treatment and was very concerned about losing health insurance. But when she reached out to the hospital system, she found out that she was eligible for a program directly through that system to keep her in her treatment and moving forward, which I wasn't familiar with that. So that was really good education for me, but it was also really good for her because it just alleviated all of that fear.
Exactly, because she's got enough stress on her plate as it is,
Right.
and that's one less worry. And yeah, I'm pretty confident Cleveland Clinic. I'm not sure about the other facilities, but Cleveland Clinic does pay for Cobra. So if there is an option, or depending on the circumstances, that could be an option for folks.
Interesting. Okay, great.
Mhm.
Speaking of Cobra,
Mhm.
there seem to be a lot of misconceptions about what Cobra is and how it works. And, do you just automatically go on to Cobra, or is it worth exploring these other options? So talk to us a little bit about that.
Sure. Cobra is definitely worth adding it to the list of options. It really depends on the individual and what size company they're coming from. So, certainly the larger employers, there is more of a reasonable premium from the Cobra. But when you get into the smaller employers, unfortunately, it can be a budget restricted in jumping on a Cobra plan. They do have 60 days with which to elect Cobra. A lot of times they've already made up their mind right out the gate once they see those premiums, but it's definitely something to, again, that list of options and go through all those choices that are available, and look at those premiums. I just actually talked to a gal. Her premium for her and her husband was $862. She said it was affordable, but we talked through some of their other options, and I'm really hoping that they do go that direction, because I would rather see the money in their pockets and growing versus paying out all that money for an insurance plan. So I try to talk through some strategies because I know these premiums are high. And to me, it's not about the sale. It is about looking out for folks and making sure, that they're aware of all their options. So I'm not sure she's going to go that direction, but yeah, Cobra can definitely be cost prohibitive, but it's a good option to have on your plate.
So, what are some of the considerations that you recommend people keep in mind as they're evaluating beyond just the premium, like when they're comparing their insurance options?
Certainly. So the network is really for first and foremost, because if they are comfortable with the Cleveland Clinic, we're in Northeast Ohio, and we are blessed with all the health systems that we have in this area. So if they, that individual, that family prefers one hospital system over the other, then that is really something to zero in on. Medications is another one. The formulary lists are different with all the providers. So really, the budget, the network, and their prescriptions. Is it going to be easy for them to transition to that new plan based on what they are looking for in a health insurance plan?
Sure. Now, I know that we are in Northeast Ohio, but there are people watching from all over. Stephanie, you
Mhm.
work with people outside of Ohio as well, correct?
I do, yes.
Okay. What states do you work with people in?
Certainly. Indiana, Florida, New Jersey, Nevada, Michigan. I think those 6 states.
Okay, terrific. Thank you. So if you're watching from any of those 6 states and you need help, you can always reach out to Stephanie. Now, when somebody knows that they are coming up on a life transition, whether it is maybe they're worried about losing a job or they're planning to change jobs, maybe they're getting married, maybe they're going forward with a divorce, maybe they're having a baby. You know, there's so many life transitions that impact health coverage. At what point do you recommend that people start to explore their options?
At least 30 days out, 30 to 45 days out to, really review the plan options. In my experience with the folks that I've worked with, I've had folks that their employers have told them that they're not eligible for their plan. They're going through what is called a qualifying life event, but and they've got another option within an employer. And I've had employers tell them that they're not eligible, and I'm like, no, this is a qualifying event. So based on some challenges that they may have, and then 30 to 45 days is definitely what I would recommend.
A minimum.
Minimum.
Okay.
Mm-hmm.
And are there any pitfalls that you have seen when people are going through a big life transition that you have some advice around how to avoid?
Oh my goodness. Yeah, that's a tough one.
I'll tell you my own experience while you're thinking about it, Stephanie. When I went through my divorce, I did not realize that my health insurance was going to end the day of my divorce. I thought it actually went through till the end of the month, and I had a procedure just like right after my divorce. But then I had to deal with all of the medical bills around that just because I had no idea at that time.
And that is a very good point. Some of the plans, they can end the day of or at the end of the month. So that is definitely a very good point to bring up. I was just thinking of different folks with different medical conditions and the circumstances between choosing one of the options, and especially when you're using providers from all these different facilities. You really have to determine what is more important on some of these plans. Based on the limitations, because they're limitations. Now, the one nice thing for sole proprietors is that there's small group coverage available through locally Medical Mutual. Even if you're just an individual, you're able to get a group plan. So that has been a good thing for folks during transition and not realizing that that is an option versus the short-term individual or marketplace plans.
Okay. And when somebody knows that they have a change in their life coming up and they're likely to have to deal with making a selection around insurance, what's the first step that you recommend that they do?
Evaluate all the options. Get a list together as far as the medications. A lot of in our technology these days, it's so easy to go to your hospital system or your provider and print out that list and your provider list, and make that list of what is your important. Are you going to be traveling? That's another important thing too, because some of these plans, the marketplace plans, do not go outside the state, so that can be a little tricky. COVID did open up the nurse lines, which are great now, because if you are outside the state and you're restricted with your plan, then certainly calling a nurse line has good avenues. Is this going to be an emergency? And do I need to go to a hospital system, or is it something that can be handled?
Okay. Any other steps you would recommend that they take as they're exploring their options?
Talk to a broker. Definitely talk to a broker agent, because they're going to help you really think through some things that you may have not thought through depending on your situation. So I do think it is important. The marketplace has where you can reach out to a broker agent and get a referral to an agent that's in your area. There's no obligation. The brokers, no obligation to work with a broker. Their role is to help you and guide you. And if it leads to a sale, then they are paid by the carrier. So don't feel hesitant that you've got to pay somebody a fee, to ask these questions. And I just had a lady who is still on her husband's plan, and she needs a surgery, trying to navigate her group plan. It doesn't cover that particular doctor. So I gave her some thoughts on how she should proceed based on what her potential out-of-pocket costs are. No obligation. And she's very grateful. And I was grateful that she reached out and that the points that I made were helpful to her. And that's what it should be, is helping other people.
Absolutely. And it doesn't affect their premium either, right? Like they're not paying you,
Right.
but they're also not paying any more in their premium either. Right?
They are not.
Yeah.
Very good point. Thank you for bringing that up. Yeah,
Absolutely.
everybody thinks that, it's going to be a different fee for a different agent. No, the premiums from the carriers are all the same, whether you go on the marketplace or through a short-term plan or an individual plan. It's not going to be, $20 higher with somebody else or lower with somebody. The rates are what they are.
Okay, great. And when they reach out to a broker, what should they be prepared for? What kinds of questions do you ask? Like what should they expect from that conversation?
Sure, absolutely. Really, it's what's important to them. Are we covering the family? Are we covering an individual? What is your medical utilization? You're not getting into any particulars on the health, due to HIPAA and everything, but it is important to know what the utilization is, because these plans have high deductibles. So we have to really be cognizant of, are they looking for a lower deductible or a higher deductible, and what's going to be palatable? For along with that premium and the doctors and the prescriptions and how much they travel. So really, all of those questions. I had a gal recently, she had a high medication, and she was working with several of us brokers, in all honesty, and picking everybody's brain. And she ended up going with the plan that had the travel plan, because they're intending on moving to Florida. So we don't know when these circumstances happen to us in life. So it was a plan that she felt comfortable in moving in that transition and traveling in and out of the state. So it's really key to ask a lot of questions.
Okay.
Yeah.
Terrific. Stephanie, if somebody wants to reach out to you for more information, where can they find you?
Sure. Thank you. My website is www.insure, INSURE, with WITHSS.com. So insurewithss.com. Or my phone number is 440-476-8559.
Terrific. And we will put both the website and the phone number in the comments below this video, so that way people have easy access to it, and you can reach out to Stephanie directly with any questions that you have. But we will also come back and look at the comments, and I'll send any questions or comments that you have for Stephanie her way, so that way we can make sure to get your questions answered. I know this is a topic that a lot of people have concerns about for a variety of different reasons, and we want to make sure that you're getting the support that you need. Stephanie, is there anything that I didn't ask you today that you wanted to make sure that people walk away with?
I don't think so. I just want to stress that don't be afraid to reach out to an agent broker. Their fees are paid by the carriers. So gain your knowledge. It's all about feeling comfortable with your choice. And so don't be hesitant to reach out to your broker agent. And yeah, because this is a big decision. And you want to make sure that it's going to be the right fit.
I love that you said that because so many people, especially with the marketplace, are so overwhelmed when they get into that system. And knowing that you don't have to navigate it alone, that there are people like you who can help to really make sure that you're getting the information that you need to make the right selection. But the other piece is that I see when I'm doing financial planning with folks is a lot of people don't have the right kind of insurance based on what their needs are or based on the options available through their employer or what have you. And so having somebody who really understands the ins and outs, is trying to understand what your needs are and can make that match is really valuable. So I really appreciate you spending the time with us today, Stephanie. Thank you for being here. And if any of you do have questions, again, I just encourage you can leave them in the comments, reach out to Stephanie directly. There's no reason that you have to navigate this alone.
Well, thank you, Leah, for the opportunity. I'm grateful for this opportunity. Thank you.
You are so welcome.